In Fox 5 Health News, New Jersey health officials are investigating what's believed to be the first case of homegrown malaria in the state since 1991.
All right, join us now, Dr. Serge Sucker, Chief of Infectious Diseases at Holy Name. Doctor, thanks for being with us. So walk us through exactly what this means as far as how this person contracted it.
Sure. So let's look at the global burden. About 600,000 people die every year of malaria. The vast majority of those are in sub-Saharan Africa. We also see a lot of cases in Southeast and East Asia. So this is not something we see typically in the United States. However, the vector, that is the mosquito that spreads the parasite malaria, is present in New Jersey. That's called the Anopheles. And we do see about 100 cases of travel-related malaria every year. Myself, other ID doctors that do travel medicine counsel patients when they're going to areas of the world that are endemic for malaria. We give them advice in terms of preventive measures, malaria prophylaxis they can take. In this case, the most likely explanation is someone came back from a malaria endemic area. They had malaria. The mosquitoes, which again are present in New Jersey, bit that person, and then subsequently bit a person in Morris County who had not traveled, who did not have the typical risk factors, and that's how the acquisition was done. This hasn't been done like this hasn't been seen since the early 1990s, but it is important. It kind of reinforces the idea that yes, we as doctors, we always teach our medical students and our residents to ask about travel history. But since we do have warmer and wetter climates, we do see these mosquitoes and their growing seasons extending, right? So we have later falls and earlier springs. This is something that we do have to think about. It's not certainly something that's very common. It does not mean that everyone out there has to be concerned about getting malaria in New Jersey. The investigation is still ongoing, but that's the most likely explanation at the present time.
Yeah, it's very interesting and concerning indeed.